Hi, my name is Logan Boss.
I'm Jessica Ray.
I'm Tamia Brown.
And I'm Bria Ford.
And we are all from the Florida State University College of Nursing. Today we're going to tell you about the prevalence of coronavirus in Tallahassee, Florida, as well as some resources to look up updated statistics. We're also going to tell you some signs and symptoms to watch out for, and how to wear a mask correctly, and some other tips and tricks to keep you and your family safe when you're out and about during these times. Before we get into the information, we're going to go through a quick pre-quiz. For the first question, you should select what are the best resources for accurate COVID information. Secondly, which is not a way to prevent transmission of coronavirus? Third, which of the following are COVID symptoms? And fourth, how to properly wear a mask. We will get to all of these answers later in the presentation. The first thing we're going to look at is some coronavirus resources with accurate and updated information. Here you'll see the Florida Health Charts website, your community resource and community health assessment resource toolset. This is your homepage for anything having to do with health and wellness related to the residents of Florida. At the top, you can see there's a box for the novel coronavirus called COVID-19. And this is where you can come to get any new and updated information. If you click on Learn More, it takes you to a new page that's all dedicated to coronavirus with hourly, by-the-minute, immediate updates for you and your family. If you scroll down, you can see and click See Latest Data, and it'll take you to the current situation in Florida. As of today, there are 278,000 positive residents, a couple thousand non-positive residents, close to 300,000 total cases, and over 4,000 deaths in Florida. If you continue to scroll down, it will break down the testing results, the positive cases by exposure, and the positive cases by testing source. If you scroll back up to the top of the page, you can see that it will take you to if you scroll down, see dashboard. This is the coronavirus 19 dashboard. So these are some of the same numbers you saw on the earlier page, but then you can flip through different graphs, like I said, that were updated daily, sometimes minute by minute, take you through the positive test, and it even breaks down cases by county. Since we're talking about the prevalence in Tallahassee, we're going to scroll down to Leon County. Here you can see that over 2,000 residents of Leon County have tested positive, 50 non-residents. There have been 65 hospitalizations and 8 deaths. Here is also a map that breaks down the prevalence by county, which is shown by the darker colors. You can see there's a lot of darker colors down in South Florida, but Tallahassee is also darker blue than the counties around it. If we zoom in, we can see that Leon County is definitely more prevalent with COVID than the couple counties surrounding it. This map also breaks it down by zip code. And of course you can see that it's darker in South Florida because there is a higher prevalence of COVID there. But if we come up and go over to Tallahassee, you can continue to zoom in and see exactly what parts are most prevalent. Now we're back to just some different statistics which are all available for you on this website. It even gives you global cases and global deaths if you're looking for that kind of information. Now we're back to the first page, and I hope this was helpful, and now we're going to tell you some symptoms and signs of coronavirus.
Next, we will talk about signs and symptoms of COVID-19. These may vary between person and in severity, but we will show you some of the most common signs to look out for. This is so good. I can't taste anything. My muscles are so sore. My head hurts so bad. Just to recap, the most common symptoms are a dry and non-productive cough, sneezing, sore throat, headache, body aches, fatigue, loss of taste and smell, and then fever and chills. Although we have mentioned some common symptoms that are less severe, you should go to the emergency department if you have trouble breathing, persistent chest pain, new confusion, bluish lips or face, or the inability to wake. Also, keep in mind that some people may be asymptomatic altogether, so it is also important to follow safety precautions to prevent the spread of infection. Since people can be asymptomatic, it's best to also protect yourself and other people around you. One of the best ways to do so is to always wear a mask when out in public or around other people. In this segment, we are going to show you how to make a mask at home and the proper way to wear one.
There are various types of masks that can be worn during this time. I'll be showing you two types of masks that are most common for people who are not in the medical field. Just like in the video we showed you, here's an example of a cloth mask. The cloth mask can be made with straps that go behind the ears or straps that go behind the neck and the head to alleviate stress on the ears. Secondly, there's a surgical mask. Now that we've shown you the different types of masks, we're going to show you how they should and should not be worn. For masks that have straps on the sides, you're going to place them behind your ears, making sure that your nose and mouth are covered. If you have glasses, it kind of makes it easier to put the mask underneath. And pull.
So wearing a mask sometimes can cause a little bit of discomfort behind the ear, so a solution is an ear saver. So what you do is put your mask on normally. You take one of the ends that stick out and just loop it behind the ear loop right here. And then do it for the other side. And then there you have it, so it's not on your ears and it'll save you some of that discomfort. And then if you don't have an ear saver, another thing that you can do is take a paper clip and just loop the ends of the mask inside of it, and it'll also take some of the pressure off behind your ear. So next I will show you how to put on a different mask that doesn't go directly behind your ears, but instead the straps go behind your head. So you're going to face the mask outward like this, and just flip it over. Take this strap and slide the mask all the way down so you have a nice space to fit your head through. And then you're going to place the string on the nape of your neck and slide the mask all the way up until it touches your neck. Next, you take this top opening and you just slide your head through like this. Once this is on, make sure the mask is tight around your nose and around your neck. And then you just slide the string to tighten it. And then you'll have a tight seal around your mouth and your nose.
Now that we've discussed the proper ways to wear your mask, we're going to go over some improper ways that you may see people wearing a mask and which you should avoid because they will not help to protect you from catching coronavirus. All right, everybody apply your masks. Here you can see that Bria is wearing a mask, but it isn't covering her nose or mouth, essentially serving no purpose because she's not protected at all. Similar to Jessica. Jessica's mask is hanging off of her ear. You've probably seen people wear their mask like this because it's easier to talk and function out in your life when your mask isn't on, but it's not protecting you, so make sure to wear your mask properly. And Tamia's mask is only covering her mouth, but COVID can be spread through mucous membranes, and you should also cover your nose to keep you as protected as possible. Now that we've discussed how to correctly and incorrectly wear your mask, we're also going to let you know some other things to keep you protected when you're out and about with your family during these times. The top 3 ways to protect yourself aside from wearing a mask include social distancing, not touching your face, and hand washing. We're now going to demonstrate how to do each of these things correctly and explain why they help in decreasing your risk of catching coronavirus. The first thing we're going to talk about is how to correctly wash your hands. As you can see by this graphic, you should begin with wetting your hands under the running water, applying soap and rubbing your palms together. You should rub vigorously to ensure that the soap is getting everywhere on your skin. Spread the soap and lather over your back of your hands and make sure it gets in between your fingers. You should try to get under your fingernails and in between each fingers. A tip is to wash your hands for at least 20 seconds, and to aid in doing this, you can sing a song. People have said you can sing Happy Birthday. You can also sing your favorite chorus from your favorite song. You should make sure to wash your hands correctly because it helps prevent the spread. You may have touched something that may be contaminated by someone that was sick, and proper hand washing can help reduce the risk of these transmissions. Now we're going to show you a quick clip to ensure that you are covering all areas of your hands when hand washing.
Put soap in the palm of our hands and then begin to rub in between like so. But as you see, there is no soap on the back of my hands, so I'm going to interlace my fingers palm to palm, and then I'm going to do the same technique on the back of my hands with each hand. And then you're going to take the back of your fingers to opposing palms with fingers interlocked. And then start rubbing your thumbs. And then you're going to take your fingertips, clasp the fingertips in the right hand in the left palm, and vice versa. Rub your wrist one last time to make sure your hands have been completely covered in soap. Thanks for watching.
The next thing we're going to discuss is social distancing. The guidelines state that you should stay 6 feet apart when out in public, and also you should not gather in groups of more than 10. If you've been to the grocery store, you've probably seen something like this where they have X's marked on the floor and even directional arrows for the aisles. The X's help let you know how far apart to stay when you're shopping or out in public. If there are not any X's on the floor where you go, many stores have tile floors, and these tiles are usually a foot in length. You can count 6, so you make sure to remain far enough away from those around you. Social distancing is an effective way to try and decrease your risk of catching coronavirus. The reason is because coronavirus is spread through coughs and sneezes, and when you maintain your distance, it is much less likely that someone's cough or sneeze may come into contact with you. The last method we're going to discuss when it comes to trying to decrease your risk of catching coronavirus is not touching your face. While you may want to touch your face if you're wearing a mask because you may need to adjust it, it is important that you make sure not to, because as we mentioned earlier in the hand washing part, you may have touched something that someone that was sick came into contact with, and this means your hands are dirty. So if you touch anywhere on your face, like your mouth, your nose, or your eyes, you have mucous membranes in this area, and the disease may come into your body through these areas. Now that we've gone over the prevalence rates of COVID in Florida, the resources where to find accurate information, the signs and symptoms of COVID, how to wear a mask, and also how to make a mask, and lastly, other ways to decrease your rates of transmission or catching the disease, we're going to take our post-quiz. For the first question, what are the best resources for accurate COVID information? You should not use Twitter, Facebook, or Instagram, and instead use the Florida Health Charts website for accurate and up-to-date information. Secondly, which is not a way to prevent transmission? From this video, you know that wearing a mask, washing your hands, social distancing, and refraining from touching your face are all effective ways to decrease your transmission. Therefore, you should not go to parties. Third, which of the following are COVID symptoms? We know now that cough, fever, headache, loss of taste and smell are all symptoms of COVID, along with many other symptoms. Fourth, how to properly wear a mask. We have demonstrated that hanging it off your left ear, covering your chin, and only covering your mouth are not proper ways to wear your mask. And we also know that masks are absolutely necessary. So, the proper way to wear your mask is covering your nose and mouth.
Hi, we hope you've enjoyed our video and you've learned a little bit about coronavirus, especially where to find statistics and up-to-date information, also some signs and symptoms to watch out for, and particular ones to watch out for when you should go to the ER. You should also know how to make a mask and how to wear it properly, and also other effective ways to decrease your transmission rates. We thank you and we hope this was helpful.